It's had to imagine today, but imagine being transported thousands of years back in time. You've been gravely injured, perhaps in battle or during a hunt. What options would you have when hospitals don't exist? Sterile tools are a distant dream, and even pain relief is rudimentary. And yet, against all odds, ancient civilizations dared to save lives through ingenious surgical techniques. But how did they manage to succeed? And how did their patients even survive? And what if I told you one of the oldest known surgeries in human history was trepanation, which dates back over 7,000 years? During this time, early healers across Europe, Africa, and South America used sharp stones or bone tools to drill or scrape holes into the skull. But why, you may wonder, would anyone endure such a procedure? Often it was an attempt to relieve severe head injuries, cure epilepsy, or even release what were thought to be evil spirits. Remarkably, evidence shows that many patients survived these operations, as indicated by the regrowth of bone. And while it may seem barbaric to us today, this practice signified a critical leap in understanding trauma. And here's something you didn't know. The ancient Egyptians took surgical innovation to a whole new level. They recorded their expertise in texts like the Edwin Smith Papyrus, dating back to 1600 BCE. In these writings, we find descriptions of treating dislocated jaws, sewing wounds, and even managing fractures with splints. In addition, Egyptian surgeons utilized tools crafted from bronze, such as scalpels, forceps, and probes. But what truly set them apart was their unparalleled understanding of anatomy, gained through their detailed embalming practices. Coupled with a blend of spiritual rituals and medical care, Egyptian surgeries were as much about faith as they were about skill. Although in ancient India, around 600 BCE, the legendary physician Sushruta made groundbreaking contributions to medicine. Known as the father of surgery, he authored the Sushruta Samhita, which detailed over 300 surgical procedures. Among his many innovations was rhinoplasty, or nose reconstruction, a procedure used to restore noses that were often mutilated as punishment. Using flaps of skin from the forehead, Sushruta pioneered skin grafting techniques that are still echoed in modern surgeries. Furthermore, he employed iron scalpels and herbal sedatives, demonstrating a harmonious blend of precision and care. But did you know the Greeks and Romans also advanced surgical knowledge, particularly on the battlefield? Greek physicians like Hippocrates emphasized observation and cleanliness, concepts that resonate with modern surgical ethics. Taking this knowledge further, the Romans perfected battlefield surgery using bone saws, tourniquets, and clamps to treat traumatic injuries. Not only did they create tools for extracting arrows, but they also established military hospitals called Gae Valetudinaria, laying the groundwork for organized healthcare systems. Additionally, in ancient China, surgery often took a more conservative approach. Physicians like Hua Tuo used herbal anesthesia and practiced techniques that prioritized non-invasive methods. Moreover, Hua Tuo is said to have developed the earliest forms of surgical anesthesia using a mixture of herbs. And while invasive procedures were rare, Chinese healers focused on maintaining harmony in the body, a philosophy central to their medical tradition. However, turning our attention to the Americas, the Aztecs and Mayans demonstrated exceptional skill with tools like obsidian blades, which were sharper than even modern surgical steel. These blades were used for intricate procedures such as tumor removal and wound debridement. Combined with herbal antiseptics, these ancient techniques reveal a surprising level of sophistication. However, their surgical practices often blended with ritual, reflecting the deep interconnection between medicine and spirituality. And also in the 10th century, where Arab surgeon Al-Zahrawi compiled the first comprehensive surgical encyclopedia. His text detailed procedures ranging from cauterization to dental surgery and introduced innovative tools like surgical scissors and scalpels. This knowledge, preserved through the Islamic Golden Age, would eventually spread to Europe, forever shaping the course of medicine. Of course, ancient surgeons faced immense challenges. Pain management was limited to alcohol and herbal sedatives, and the risk of infection loomed large. Nevertheless, their ingenuity and resilience paved the way for the sterile, high-tech surgical procedures we rely on today. Their legacy reminds us of the lengths humanity has gone to in the pursuit of healing. If this journey through history inspired you, don't forget to like, share, and subscribe for more incredible insights into the evolution of medicine.